Hi, I'm Dr. 𝗢𝘅𝗳𝗍 from Oxford Orthopaedics, and I'm an orthopedic surgeon practicing at Mount Elizabeth Hospital. Today we'll be talking about osteoarthritis of the knee and how we can help you treat your knee problems. Osteoarthritis is fundamentally a problem where the cartilage in the knee has begun to degenerate and gets worn out over time, where the bone in the joint is rubbing against the other bone, and as a result causes pain in the knee, and that eventually leads to deformities and stiffness in the knee as well. The most common symptom for osteoarthritis is knee pain. Other symptoms include swelling in the knee, redness and warmth in the knee. Some patients also notice that the knee becomes a bit bent or deformed over time. And lastly, the patients also get stiffness in the knee. When osteoarthritis becomes worse and patients have pain that affects their quality of life, their ability to work and do their sporting activities, we often start them on treatments such as physiotherapy to strengthen the knee muscles and reduce pain by improving the knee stability. Other things that help include using knee braces, which can also improve stability in the knee and reduce pain. And occasionally some patients will benefit from some pain medications when the pain flares up. So more invasive options include injections to the knee. Quite commonly we give what we call viscosupplementation or lubrication injections into the knee joint. This helps to keep the knee lubricated and supported and can reduce pain in some patients. Another option is steroid injections, which reduces inflammation and swelling in the knee and can also reduce pain, but usually the duration of effect is quite short, maybe for about 3 months. And all these and the pain is still severe enough to affect quality of life, we then consider surgery as an option. Traditionally, we offer knee replacement surgeries, and this includes both total knee replacement and partial knee replacement surgeries. This is a partial knee replacement, and we can see that only about 1/3 of the knee joint is replaced. The middle and the outer parts of the knee joint are left intact. Partial knee replacement is a very good choice for the patient because we preserve most of the patient's native knee and only resurface the area that is damaged. So this is a model of a total knee replacement surgery. The replacement involves 3 components. There is a femoral component which is attached to the femur or the thigh bone, and then there's a tibial component here, this base plate here, that is attached to the tibia or the shin bone. And in between these 2 metal components, there is a plastic component to help with lubrication and to prevent the metal components from rubbing against each other. And you can see that the entire joint is replaced by a metal prosthesis. The difference between a total knee replacement and a partial knee replacement in this case is that the plastic piece in this particular design is able to move freely in the joint as the knee moves, and so this gives a more natural feel to the knee, and it also results in a less wearing out of the components of the knee joint because the stresses are able to be shared better. Partial knee replacement surgery, when compared to a total knee replacement, is safer, it's better, and gives you faster recovery. So we say that it's safer because there are studies that show that it has fewer complication rates and less problems than a total knee replacement with less blood loss. We say it's better because it offers patients better bending and range of movement compared to a total knee replacement, and also results in a more natural feeling knee. The reason for that is because we preserve about 70% of the native knee joint in a partial knee replacement, whereas in a total knee replacement, the whole knee joint is replaced by a metal implant. And we say that it's faster recovery because partial knee replacement is done through a minimally invasive technique. So this results in a scar that's only about half the length of a total knee replacement scar with less damage to the tissues. This means that there's less pain after surgery and much more rapid return to walking, activities and work. And patients normally only stay about 1 to 2 days after the surgery. In general, for a total knee replacement, it takes about 2 weeks for the wound to heal, and there is usually quite a lot of pain in the first month, and rehab in the form of physiotherapy normally takes about 2 to 3 months for patients to become independent in their daily activities without aid. For partial knee replacement, the timings are about half of that of a total knee replacement. The wound healing still takes about 10 to 14 days, but in terms of return to activity and work, we normally can achieve that in about 4 to 6 weeks, so roughly half the time of a total knee replacement. And in 80 to 90% of patients, it begins first on the inner side of the knee before eventually spreads to the outer compartment as well as the kneecap over time. So we find that patients who come to see us for painful knees with arthritis, about half of them have arthritis that's only limited to the inner side of the knee, and the outer side and the kneecap are actually healthy and fine, and so these patients are good candidates for partial knee replacement surgeries. Conversely, if the arthritis is already involved more than one compartment, most commonly the inner and the outer compartments, then these patients might benefit more from a total knee replacement surgery. I think all partial knee systems on the market, in Singapore anyway, are validated and are of good quality, and they have good track record. What perhaps sets the Oxford system apart from the other implants is the long track record that the Oxford implant has had. It's had about 40 years of history, and it's now in its latest generation, probably the 4th iteration right now. The current system right now uses a cementless method, so we don't need to use cement to implant the prosthesis. Instead, the prosthesis is specially coated such that the patient's bone grows into the implant and continues to hold the implant for as long as the patient lives. So this leads to better longevity of the implant compared to one that's just fixed by cement. The other advantage of the Oxford knee is that because of its long history and its affiliation with Oxford University Hospital, there's a lot of data available on how it works and which patients it works best. Usually with painful arthritis of the knee, the pain just gradually gets worse over time as the knee gets more degenerated and more injured. So patients will notice that they have more painful knees and they can walk less. They will also get knees that are more stiff and a bit less stable, and they might find that their ability to do their daily activities becomes compromised, and sometimes even their sleeping is also affected because of the pain at night. Pretty much nothing. The whole idea of a knee replacement surgery is to get you back to activity and to doing what you want to do so that you improve your quality of life. And at the same time, by staying active, you also maintain a good level of general health and fitness, which will benefit you in the long term.